Today, we'll start a topic on pharmacokinetics, ADME. This session includes two topics in that, absorption and distribution of drugs. In our earlier session, we studied as to what the drug does to the body, that is pharmacodynamics. In this session, we'll learn what the body does to the drug, that is, it deals with pharmacokinetics. ADME is the four-letter acronym for absorption, distribution, metabolism, and excretion. This is what a body does to a drug. ADME is one of the bottleneck of all drug development programs. Absorption is the process by which the drug moves from the site of administration to the site of measurement, that is the blood plasma. The factors that affect the absorption of a drug can be broadly divided into two categories: the chemical properties of the drug and the physiological variables of the body. In general, smaller molecules diffuse readily across the membrane than larger molecules because the diffusion coefficient is inversely related to the square root of molecular weight. Since membranes are hydrophobic, lipid-less, they are more permeable to non-ionized drugs. The pH on either side of the membrane determines the equilibrium on each side. Greater the partition coefficient, higher the lipid solubility, and greater would be the diffusion across the membranes. Certain physiological variables that depend on absorption on drugs are the gastric mobility, pH at the absorption site, the area of absorbing surface, the blood flow, presence or absence of food in the stomach, pre-systemic elimination. The route of administration of the drug and the formulation of the drug affects the absorption of the particular drug. Drug solutions are absorbed faster when compared to tablets and capsules. Similarly, the route of drug through IV is absorbed more readily than oral. Absorption depends upon the mode of delivery of the drug, that is oral, parenteral, or topical. The primary route of exposure is the GI tract, respiratory tract, and skin, other than the injection and the implants. Most drugs undergo GI or gastrointestinal absorption. This is the concentration of the drug that is absorbed from the gut lumen into the portal circulation. The major factors that affect the absorption within the GI tract is the type of cells at the specific site, the period to which the substance remains at the site, and pH of the stomach and presence of intestinal contents at the site. Example, substances like nicotine are readily absorbed through the mouth mucosa. Acidic pH of the stomach favors absorption of non-ionized and lipid-soluble drugs. The stomach breaks down certain substances into simpler forms. Hence, drugs are coated with substances like gelatin, which can pass through the stomach into the intestine. The presence or absence of food at the site too affects the absorption of the drug. The pH of the small intestine favors absorption of lipid-soluble small molecules and drugs which are slightly acidic or basic by passive diffusion. The slow movement of the indigested substances and presence of intestinal villi increases the surface area of absorption. Absorption by means of active transport or carrier molecules also occur in the small intestine. The intestinal microflora too affects the absorption. Absorption is less in the colon and the rectum region. The present slide summarizes the points that we discussed for absorption of drug in our previous slides. Bioavailability. It is an important parameter in pharmacokinetics which helps to estimate the fraction or concentration of drug that reaches the systemic circulation. It varies depending upon the factors like the route of administration, age of person, disease conditions, drug formulations to be some. Intravenous drugs are directly injected into the systemic circulation. Hence, its bioavailability is 1 or 100%, while for oral dose it is always less than 100%. The area under the blood concentration time curve, as shown in the adjacent figure, helps to understand the bioavailability and rate of absorption of the particular drug. Example, in the adjacent figure for drug A, B and C. The rate of absorption of drug A and B are equal and it is more than C. But its bioavailability is more than that of B. These parameters affect the duration of action of the drug and the effectiveness of the action. The bioavailability of a drug depends upon two factors, the extent of absorption and first-class pass clearance. The extent of absorption of the drug depends upon various factors like the molecular weight of the drug, the formulation, the pK value of the drug, the route of administration of the drug, the nature of the drug as to whether it is hydrophilic, lipophilic, the pH of the medium, the gastric intestinal mobility, and many such factors. First pass clearance. The drug, after absorption across the gut wall before getting into the systemic circulation, passes on to the liver. In the liver, in majority of cases, some amount of the drug is excreted into the bile. This is known as first pass clearance. Hence, for oral drugs, the bioavailability is always less than 100%, while for drugs administered through IV, the bioavailability is 100%. The effect of first pass on bioavailability is expressed as extraction ratio, which is the ratio of clearance value of drug from the liver to the hepatic blood flow rate. The hepatic blood flow rate is normally 90 liters per hour in a person weighing 70 kg. When we talk about hepatic clearance, it depends upon two factors, the hepatic extraction ratio and the hepatic blood flow, as represented in the equation in the earlier slide. The systematic bioavailability of a drug can be predicted by the extent of absorption and extraction ratio by the formula bioavailability is equal to product of extent of absorption into 1 minus the extraction ratio. Bioequivalence. Two drugs are said to be bioequivalent if their rates of absorptions are nearly similar and they show no clinically important difference between their effects. If the AUC value is or the AUC ratio of the two drug ranges between 0.8 to 1.25, the drug company can claim that the two formulations are bioequivalent. It is an important step in marketing generic competitor products. Distribution. Distribution is a reversible process of dispersion of drug from its site of absorption to different parts of the body, that is, from the vascular space to the extravascular space, as shown in the figure. The human body, which constitutes about 60 to 70% of body fluid, can be compartmentalized into three major compartments: the intracellular fluid, the interstitial fluid, and the plasma, as shown in the figure. In a healthy adult male, approximately 3 liters is the intravascular liquid, where the drug constituents are concentrated immediately after absorption. This drug is then distributed to various organs and tissues of the body by the extravascular system, that is the interstitial fluid and the intracellular fluids. The concentration of the drug at the site of action affects its effectiveness. Therefore, it is necessary to study the pattern of distribution of a particular drug when administered through different routes, and its distribution to various tissues and organs. Now, let us consider a drug dose of 30 mg is administered by intravenous system. Example in figure A. Now, the concentration of the drug in the intracellular space is mass divided by volume, that is 30 mg divided by 3 liter, which comes to be 10 mg per liter. Now, here we consider the drug concentration as 30 mg in the intravenous system, because here the mode of delivery is IV, so the bioavailability would be 100%. That is 30 mg in the intravascular compartment. Figure B. With time, the drug passes from the intravascular system to the extravascular system. That is, the 30 mg drug is now distributed in 14 liters of body fluid. Thus, the concentration of the drug in the blood plasma decreases, and in an ideal condition, it would be 2.4 mg per liter, that is 30 mg drug distributed in 14 liter. So, the concentration is 30 divided by 14. The volume to which the drug is distributed is called the VD, or the apparent volume of distribution, and it helps it to estimate the drug concentration in the body. If we plot a graph for plasma concentration of drug against time, it would decrease with time. Example, at time 0, in this particular case, it was 10 mg per liter. After 2 hours, it came down to 2.14 mg per liter. The interpretations that can be made by this curve or study is that a low VD value means the drug stays in the intravascular system, while a high VD value implies that the drug is moved on to the extravascular system. So, the apparent volume of distribution, that is AVD or VD, is calculated by the ratio of dose to plasma concentration. The volume of distribution may be defined with respect to blood, plasma, or water, that is the unbound drug, depending upon the concentrations used in the equation. The distribution of a drug into a body depends upon the blood flow, the capillary permeability, the degree of binding of drug to plasma and tissue proteins, and the relative hydrophobicity of the drug. Blood flow affects the rate of distribution of drug. The blood flow to organs like heart, liver, brain, and kidney is more compared to the other parts of the body. Hence, these organs receive a larger concentration of drug during the first few minutes after absorption when compared to other parts of the body like the muscles and adipose tissue. The blood capillary permeability too affects the distribution of the drug. Drugs with low molecular weight can easily pass through the capillary pores. The distribution could be by means of passive diffusion or active transport. The drug absorbed in the intravascular system is not uniformly distributed to all parts of the body. Body compartments accumulate some amount of drug, leading to decrease in bioavailability. These regions are known as reservoirs. Some of the drug reservoirs are plasma proteins, cellular components, and GI tract. Some drugs bind to the plasma proteins, example, weak acids to albumin protein, basic drugs to alpha-1 acid glycoprotein, some to the lipoprotein, and also some to the RBC components. Molecules which bind to these plasma proteins fail to pass through the capillary membrane due to its larger molecular size. Certain lipid-soluble components of drug bind to the adipose tissue and get accumulated there. Some metal ion chelating agents and heavy metals get accumulated in bones. Even in the GI tract, certain weak bases get concentrated in stomach due to its large pH differences, while in some cases the drug is reabsorbed in the liver after it gets hydrolyzed in the intestine. There are certain physiological barriers too that prevent the uniform distribution of drug components from the intravascular system into the extravascular system. Example, capillary endothelial barrier, blood-brain barrier, cerebrospinal fluid barriers, placental barriers. First, simple capillary blood endothelial barriers. These endothelial barriers allow only substances of molecular weight less than 600 Daltons to diffuse across them into the interstitial fluid. Some of the drugs that are bound to the blood proteins are unable to pass through these barriers because of their larger size. Blood-brain barriers. The capillary endothelial cells in the brain have tight junctions and lack intracellular spores as shown in the figure. Drugs with high lipid water partition coefficient can penetrate through these capillary endothelial cells. There are certain carriers called P-glycoprotein present in the brain capillary endothelial cells that extrude the drugs. Next, cerebrospinal fluid barriers. The tight junctions that are there between the choroidal cells act as blood cerebrospinal fluid barriers. They act similar to the blood-brain barriers. The first figure down shows the tight junctions that are present between the choroidal cells. The figure on the right shows the blood-brain barrier and the blood-CSF barrier together. Next, blood-placental barrier. The blood vessels of the fetus and the mother are separated by a number of tissue layers that act as placental barriers. Lipid-insoluble and ionized drugs cannot pass through these placental barriers. In the testes, the Sertoli-Sertoli cell junctions also act as blood-testis barriers and restrict the passage of drugs. With this, we finish the absorption and distribution of drug under ADME topic. Thank you.